This is 17 News with continuing coronavirus coverage.
Good afternoon, and thanks for joining us. I'm Nicole Gitke. Well, now, here are the latest numbers on the coronavirus cases here in Kern County. That total now stands at 574 cases, including nine non-residents. More than 4,000 people have tested negative, and more than 3,000 people are still waiting for their results. For the first time, Kern Public Health has released the number of people who have recovered from the virus. That number is 203. Well, here's how those cases break down by age. 33 children under the age of 18 have tested positive. 331 adults between the ages of 18 and 49, 144 people between the ages of 50 and 64, and 57 people aged 65 and up. The area known as Bakersfield East, which includes parts of Arvin and Lamont, has 283 cases. That's the most of any other area. The area of Bakersfield West has 183 cases, 68 in the valley area, 15 in the mountain areas, and 16 in the desert regions.
Well, it is another beautiful day here in Kern County, and all the flowers are blooming around the area. And we also have some other good news to report, and that's our drought monitor. We were in a moderate drought just a couple of weeks ago, and now, because of the rain that we saw last week, we are now out of a drought here in Kern County. You've got a little bit of drought still and a dry period up north of us, but for Bakersfield and Kern County, we are looking good, and that's great news as we go into mid-April now. And if we get more rain, it'll keep us out of that drought. So good news on the drought monitor. As we take a look at the temperatures for today, we are expecting temperatures to top out near 84 and then slipping back into the 60s tonight. And then for the mountains, we're also looking at a very nice day with mid-60s. And then tonight after midnight, we'll again be in the upper 40s. But overall for Kern County today, looking around, we've got nothing but blue skies. We are looking at a chance of some showers rolling into our area by tomorrow. I'll have much more on that part of the forecast coming up in a few minutes. Nicole, back over to you.
Thank you, Kevin, for that. Well, several clinics and urgent care facilities are offering testing for the coronavirus. Accelerated urgent care on Coffee and Stockdale, all locations for Omni Health and Priority Urgent Care, Clinica Sierra Vista, and local hospitals. Plus, Clinica Sierra Vista and Dignity offer telehealth services so you can get a checkup from home and find out if you need a test. Well, happening today, free gas for healthcare workers. That's happening at Ramco Convenience Store on F and 23rd. Owner Romney Batik says it's a way of saying thank you to those on the front line of the coronavirus pandemic. That's happening until 6 tonight for any doctor and nurse. This is the second time this week that Ramco has offered gas to healthcare workers. Also, from doctors and nurses to grocery store employees, there are a lot of essential workers serving the community in the middle of this pandemic. Being an essential worker during this time comes with some inherent risk, leading many companies to offer incentives to workers. Walmart gave hourly workers a special cash bonus for their hard work during this time. Target has also announced it will give its workers a temporary $2 an hour raise. Those are just some of the stores that are offering their essential workers extra money during the pandemic, but other big companies have yet to follow suit. This raises the question of whether or not people categorized as essential workers should receive some sort of monetary incentive, such as hazardous pay. And that's the subject of this 17th interactive poll. All morning we've been asking, should essential workers be better compensated? 81% of you said yes, and 19% of you said no. Someone texted us this comment: yes, the essential workers should be paid extra. They are risking their health as well as the health of their families on a daily basis to ensure that you and your family are able to get what you need. To not be compensated is an insult, as well as telling them you are not valued. And another text comment reads, no, we are not compensated for our efforts and fortunate to have an income. These times are hard for everyone, and we all need to step up in one way or another. Now, there is still time for you to weigh in. You can call or text 881-4617. Press 1 if you think they should be better compensated, and press 2 if you do not. You can also tweet, email, or Facebook your comments. We will have more of the comments and an update on the votes tonight at 5. Well, local businesses and organizations are coming together to feed the most vulnerable during this pandemic. We have more on what this relief program is doing for them.
Welcome to Operation BBQ Relief, Bakersfield.
A big task, 35,000 meals to be delivered in just 2 weeks for those with the most need.
35,000 meals for the children at the Bakersfield Homeless Center. Sabria, Mariah, Liliana, Jared. 35,000 meals at the mission at Kern County for Danny, for Robert, for Julie, for Shanti. 35,000 meals through CityServe, distributing through their partners, Compassion Christian, St. Francis, Plaza Iglesia, and Vanguard Christian. This is the coming together.
Those dealing with food insecurity during this time are receiving meals thanks to a $150,000 donation from Dignity Health and the Saunders restaurant reopening their doors to make the food.
It's everything. Saunders' mission was always, we started this as a passion project. I'm here to tell you no one goes into restaurants to make money, folks. So Saunders has always been, from the day we've opened our doors, a place that we hoped the community would come, make their own. And when you have to close those doors, you wonder where your community goes and what they're doing, much less who's inspiring them to do more and who's invigorating them.
Every day, Saunders will prepare 2,500 meals to be distributed to the vulnerable populations in Kern County through the help of local organizations. Kern County residents showing no one is alone during these tough times.
Extraordinary times when 7,000 restaurant workers could be facing the lack of jobs. Extraordinary times when our most vulnerable are going to be facing even greater exposure than ever. Extraordinary times when those who serve the most needy are homeless, have less than ever before. But during extraordinary times, the extraordinary people of Bakersfield and Kern County rise up and work together.
Nicole Gitke, 17 News. Diagnosed with terminal cancer and only months left to live, a mother is still finding joy in these uncertain times and a motivation to smile always. Last year, Megan Andrews thought the worst was over. She had beaten breast cancer. Then a month ago, just as the coronavirus hit, the Andrews family got devastating news. Megan's cancer had spread to her brain and spine. The 38-year-old was diagnosed with leptomeningeal disease. Now the Andrews family prepares for a life without Megan, a woman who chooses to see the good in everything. An unshaken hope and something good has inspired others to stand up in support of the Andrews family, all because of Megan's motivation to smile always.
I was young. My parents had a dinner party, and in my room I had a chalkboard, and one of the guests came upstairs and wrote "Smile always, Megan" on my chalkboard, and I loved it.
Smile Always has also become a movement for the family. A family friend designed t-shirts hoping the message becomes Megan's legacy. The couple has also set up a GoFundMe page, and if you're interested in purchasing a Smile Always t-shirt, you can find both of those links on our website, KGET.com. You can also see Megan's whole story tonight on 17 News at 5. And today, a local survivor of COVID-19 will become the first to donate plasma at Houchin Blood Bank to help others fighting the disease. Earlier this month, Houchin announced it would begin collecting plasma for people who had recovered from the coronavirus. The plasma can then be transferred to others with the disease. It's part of an experimental treatment approved by the FDA on an emergency basis for people in serious condition. People who recover from COVID-19 develop antibodies that remain in the blood's plasma that can potentially boost another patient's immune system and help in recovery. And one donation can go a long way.
So one donor, like I said earlier, can give up to 800 mils of plasma, and that can go to potentially 4 patients. So one donor can help 4 patients out there.
Now, potential donors will need to go through their doctors and meet the following criteria: a diagnosis of COVID-19 documented by a lab test, no symptoms of the disease for at least 14 days before donating, a negative result for COVID-19. Houchin is asking anyone who has recovered from COVID-19 and willing to help call 616-2575. Stay with us. We're back after this. Welcome back. Well, frontline workers are turning away from textbooks and onto Facebook to learn the latest from colleagues across the globe on how to combat COVID-19. NBC's Kelly O'Hara reports.
All right, so there's two basic things that a ventilator does.
Doctors on the front lines of the coronavirus fight taking social media by storm.
COVID-19 has only been in the medical literature for 4 months.
Dr. Jessica McIntyre of Pediatric Hospitals from New Hampshire and her medical school colleagues created the popular Facebook group COVID-19 Physicians and APP, Advanced Practice Providers, to try and help.
Rarely has there been a time in modern medicine where it's been so important for doctors across every single subspecialty to band together. Within 48 hours, there were over 40,000 members.
And the group just keeps on growing. Nearly 150,000 members tuning in nearly every single day to watch, listen, and learn.
You will on 3 turn the patient onto her side.
Approved followers can see videos of nurses teaching others how to safely roll over a patient or how to use a ventilator.
I think social networking, particularly in a time of crisis for health workers, is really important to support each other.
Dr. Bob Bollinger of Johns Hopkins says medicine is changing.
And I think that can be a very powerful tool, but it has to be leveraged in a way that helps support the other parts of medicine.
As for the creators of this Facebook group and its followers, social media now giving the Hippocratic Oath a new meaning. Kelly O'Hara, NBC News.
Now, millions of Americans are filing for unemployment during the coronavirus pandemic. Last week, a record 5 million first-timers filed for unemployment. Plus, your dog may be feeling the stress right now, and it could be leading to bad behavior. What can you do to help keep them in line? Your 17 Business Watch after this.
And we're talking weather now. Hopefully we'll be able to get through our weather forecast. My iPhone is a little warm, so it may overheat. We'll see what happens. That's how beautiful it is out here today. And just overall, just going to be a great day. A little bit warm, but get out and enjoy it if you can. In your yard, maybe do a little bit of gardening. Now, temperatures are expected in the 80s today. Arvin at 81 under sunny skies currently, and Wasco at 79 under the clear skies. And then up in the mountains, Frazier Park, a beautiful start to the afternoon, 63 there. And Golden Hills, also very nice, and right now checking in with 64. 80 degrees in Bakersfield right now. We will be on the way up to 84 this afternoon. 70s and 80s for the valley right now. 60s to lower 70s into the mountains, and we've got clear skies from the north to the south. Even the coastal areas looking pretty nice, but I do expect some clouds to increase as we progress into tonight. Daytime highs today into the 70s north, 82 in Fresno, 73 down in Los Angeles. Here's the big picture. One system will roll in for tomorrow. The secondary system will roll in by next Monday. So Saturday, Sunday, we get a break in between storms. Our Futurecast model, I'm not looking at a lot of rain to move on in for the Friday storm. Traced maybe a 1/10 of an inch into the mountains. And then for Monday's storm, we'll be looking at some light shower activity. Nothing like we saw just last week. Here's a look at our headlines. And you can see we peaked today right around 84. And then we talked about the chance of rain coming in Friday and then again on Monday. And then today, we'll look for temperatures to be right near 84 in Bakersfield, 82 in Wasco, Taft at 82 as well. And then for the mountains, we'll look for a nice day. 66 in Frazier Park, 68 in Tehachapi, 70s for the Kern Valley. And then for the desert, we're looking very nice today as well with 76, but a little bit breezy. Your extended forecast will be in the 70s pretty much across the board. And there's that chance of a shower Friday and Monday. And then for the mountains, you can see a 50% chance of showers tomorrow, 30% chance on Monday. Then by next Wednesday, we warm things up all around. And the Kern Valley forecast also a chance of rain by tomorrow. But again, mid-next week, all areas of Kern County will warm up once again. But today, it is just a beautiful day. So get out and enjoy the day as much as you can while, doing that self-quarantine. Nicole, back over to you.
KGET Business Watch is brought to you by Grapevine MSP Technology Services, the Valley's leading IT service provider.
Well, the Labor Department announced today that more than 5 million people filed first-time unemployment claims last week. This brings the total number of job loss since the start of the coronavirus crisis to over 22 million. This nearly wipes out all the jobs gained since the Great Recession. Today's numbers were slightly worse than most analysts expected. The dramatic increase in unemployment claims is due in part to legislation passed by Congress and signed by the president. The legislation allows more people who previously did not qualify for unemployment compensation to apply for the aid. Still, the Labor Department report shows the profound impact the coronavirus is having on the economy. And just like you might be having a tough time dealing with being cooped up, your pets could be facing that exact same stress. Lenny Supol spoke with a professional dog trainer and behaviorist who is helping families learn to cope with these changes.
Dale Buchanan is a certified dog trainer and animal behaviorist. As the founder of South Florida's Top Gun Dog Training, he's seen a spike in calls from clients over the last 4 weeks.
Excessive barking, a lot of chewing things inside the house, jumping on people and urinating and going potty inside the house as well, which they weren't doing before.
So Buchanan is getting back to basics, reinforcing obedience training with 12-year-old Spalding and Diesel, a 7-month-old puppy from Tri-County Animal Rescue.
The puppy wants to go all over the place, but, we're keeping it civil. But these guys are behaving, and this is exercise, socialization, mental stimulation, all wrapped up in one.
Juan Ortega is Diesel's owner and says his pup is already showing signs of improvement. Plus,
we have trying to walk the dog at least, more than 5-8 times per day. A lot of exercise, physical and mental exercise.
But Buchanan adds during times of uncertainty, a dog owner's stress and anxiety levels have an impact too.
Our dogs can quickly pick that up. So that's another thing to consider when your dog is not behaving properly at home all of a sudden.
I think we can all, as dog owners, relate to that. Well, so many of us are feeling alone during this pandemic, struggling being stuck at home. But what if there were things we could change in our lives to have a better outlook on the present and future? Stay with us. Welcome back. Well, throughout this time of quarantine, some of us have felt a void and missing normal routines of seeing friends and family freely or even going to the movie theater. Dr. Corey Gonzalez explains what that feeling is and how we can fill that void.
They're a lifeline for many. It's a protective measure that helps us buffer through life. It helps with our psychological pain. Actually, the newest research on suicide shows that social connectedness was the biggest remedy for people not to suicide. So it gives us an out. Somebody else cares. It gives us hope. And if you look, we are social beings. If you look at the research, several research on attachment theory, babies do not, thrive or develop if they don't have that secure connection. You look at the monkeys study by Marlowe. The monkeys did not thrive or develop unless they had that maternal touch. So it's a lifeline for many. It's essential for our mental health.
And a lot of people maybe don't know how to get that connection now that they're stuck at home and they can't do their normal routines.
Well, we've all had to adapt, and I think that's something that's going to come out of this. And I've been doing it myself. I'm no longer at the office. But we need to utilize the social, the video conferencing platforms. These things are essential. The American Psychological Association and the California Psychological Association have really let us know that this is so much more important than talking on the phone or texting or getting emails. That when we see each other, it's a different sense, and it's very important for our connectedness. So we need to get our, these things set up for each other and make time for it, individually, groups, families. And if we have elderly people in our family, people are more vulnerable, with depression or anxiety, and they're isolated. Make sure that we get them set up through their iPad or get them hooked in, send them links on their email, have these meetings with them. I know I do it with my mom that's aging. We send in and we connect with them. And it's a lifeline for a lot of people. And it's something we need to do.
Do you have ideas, though, for people who don't have that capability, who maybe don't have a device that can do a FaceTime or a Zoom conference or something like that? Maybe all they do have is a telephone.
Well, you can get, the nice thing about these things is you can get these links off your smartphone. So you can actually, and you can FaceTime as well, where you can see people. So these things are important, but also we have to get creative. Now's the time that we do need to, we've had to shut down our economy and sort of slow down and be with each other, to make time for each other. I know what my wife and I have a picnic in the backyard, or, order takeout food from our restaurants to keep them and keep them going. Play board games, just things to connect and do and try to find the best out of the situation. Because the reality is that one constant in life, Maddie, is change. Our normal today will not be the normal tomorrow. And we have to embrace these things. And whatever season we're in, we have to embrace and see the best in that and try to find the best approach. Focus on what we can do versus what we can't do. Focus on what we have versus what we don't have.
We've talked a lot about maybe adopting some mantras to push out the negative thoughts. So when you notice yourself thinking negative thoughts, maybe to replace it with some positivity. Do you have any ideas of some things that people could use to replace those negative thoughts right now?
Yeah, I mean, there's lots of apps out there that we talked about before that can help with cognitive therapy. We have to pay attention to our thoughts and our distortions of our thoughts. Now, it's okay to acknowledge a loss or something that's negative. We just don't want to get stuck. You acknowledge that loss, and after you acknowledge it, then you move on and you focus on what you can do. So it's important that you don't have to deny things. You have to acknowledge it. Yeah, things are different, or there's been a change, or there's a loss. And by the way, some of the losses people are going through right now are unprecedented and traumatic. If someone goes to the hospital, you can't see them. So it's really difficult, but we need to acknowledge our losses and then move on and focus on what we can do. We don't want to get stuck in our losses, but we want to reconstruct our thoughts, not just how we feel, but what we think, not overgeneralize. And the good stuff has to count. We have to make sure we focus on what we have and not what we don't have.
This is 17 News with continuing coronavirus coverage.